People fleecing you when you want an ambulance, fleecing you when you want an oxygen cylinder, fleecing you when you're trying to get a hospital bed. There's already a pandemic on and this is a nightmare. Dr. Rana, is this happening elsewhere as well? Have you heard of such instances in other parts where hospital beds are now being sold at exorbitant prices by some people who are involved in those hospitals and by officials?
Rahul, there is a potential for such thing to happen in the hospitals, especially in pandemic. This happens in many hospitals during normal time also. Hospital admission, keep vigilant on such things. But again, I will advise that we have got various systems that this should not happen in the hospital. This can happen in any hospital. Hospital admission, keeping vigilant. But the people in general, the public, those who are taking advantage, those who want to have bed in the hospital, they should not bribe any people for getting the service. And if some person asking for bribe, they should bring it to the administration, to administration as well as local police,
No, but everyone's making the same point. But Sujatha Rao, at that point in time, when you've got a loved one who's suffering, you think you may be losing him, your only priority is to try and find succor. This whole business, go file a complaint with the police, go call the administration. It's not as if you call a hospital landline and anyone's picking the phone and having a decent conversation with you. So these are people who are preying on the vulnerability and the desperation of relatives.
Yeah, but here it's not just only the bribing part of it, but these 4,000 beds, were they in government hospitals or private corporate hospitals or wherever? What about the hospital authorities? Why did they keep them booked like this and not be occupied by more deserving patients? They know about triaging. They know who should be admitted and who should not be admitted. I think there's a bit of a failure of duty and diligence on the part of the hospital authorities. And if this could be acted upon, then I don't think anybody would be able to. You may take a bribe, but no hospital will keep a bed for you if the patient is not deserving. There's nothing called reserving a bed for anybody. You just fill it up because people are literally standing in queues. You either die or you are discharged. The next fellow is getting onto the bed. So I think this is unacceptable. It's a failure of the health authorities also in not monitoring the availability and the occupancy rate of the beds. And if it is being done, for example, in collusion with any private authorities or something, they should be acted upon.